common hand condition called Dupuytren's contracture. Here today to talk about this condition and what to do if you are experiencing hand pain is Dr. Ryan Naujoks, a hand and upper extremity orthopedic surgeon with the Connecticut Orthopedic Institute at Hartford Healthcare. Doctor, welcome.
Thank you, Lisa. Thank you for having me.
Great to have you. So tell us, what is Dupuytren's contracture and who is affected by it?
Sure, thanks. It's a progressive disorder that affects the hands. It causes tight tissue underneath the skin to gradually over time tighten the fingers up. And people end up with sort of bent, stiff, tight fingers. Typically the ring and small finger are affected first. We know it affects about 5% of the U.S. population. It affects men more than women. It typically affects people after the age of 50 and gradually gets worse.
All right, doctor, tell us the difference between Dupuytren's contracture and trigger finger.
Sure, they both affect the fingers. Typically, trigger finger is more painful. Trigger finger is a type of tendonitis that affects how the fingers bend, and it is painful and often causes snapping, popping fingers, whereas Dupuytren's contracture causes fingers that are stiff and tight and stuck in a semi-bent position.
All right, talk about some of the treatment options.
Sure. So there are many options to treat Dupuytren's these days. If the symptoms are mild, we can simply observe it, keep an eye on it. As it becomes more limiting to somebody's function, one option is placing a needle under the skin and using that in a mini-invasive approach to stretch the finger out. Similar to that, there's a medicine that we can inject underneath the skin, and the medicine works to stretch out the tight tissue. And then finally, the last option is, for some people, the best option is a surgery, where we make a small incision, open it out, and physically cut out the involved tissue and use that to stretch out the fingers.
All right, when someone has Dupuytren's contracture, what should they do?
Well, if they have a lump in their hand, something that they can't explain, if they have trouble getting their gloves on, putting their hands in their pockets, those would all be good reasons to talk to their doctor, discuss their concerns with them, and they may refer them to a specialist who treats Dupuytren's contracture.
And doctor, tell us about your upcoming webinar on hand pain.
Yes, thank you. There are a lot of other disorders that can affect the hand. This Thursday at 12 o'clock, I'll be hosting a webinar to talk about some of those common problems such as carpal tunnel syndrome, thumb arthritis, broken fingers, things like that. We'll be happy to review all of those different disorders with people. And
doctor, is this treatable after? Does everyone need surgery, or can it be minor?
No, it absolutely can be minor. It is something that typically tends to get gradually worse over time. We keep an eye on it. If the symptoms are minor, if someone's function is good, we can keep an eye on it. Sometimes physical therapy or braces can help too as well. And sometimes we use things like cortisone injections as well.
All right, Dr. Ryan Naujoks, thank you very much for bringing us up to date. Good luck with the seminar. It looks very interesting.
Great. Thanks for having me.